Hey everyone, welcome back to my YouTube channel. Now, in the midst of a global pandemic, there may be a lot of information circulating out there that may be fake or overwhelming to understand. So today I am lucky enough to sit with an infectious disease specialist, Weyer, who is going to help us understand this pandemic a little bit better, what to do, and where to get reliable information. Lawrence is also a previous Mr. Gay World South Africa 2011 winner, as well as Mr. Gay World 2012, and has really set the forefront for a lot of previous title holders, as well as a standout community member. Thank you so much for joining us, Lawrence. Now, following our President's address to the nation last night for a national lockdown, which will be implemented from Thursday, 12 p.m., up to the 16th of April 2020, to try and mitigate the increased spread of COVID-19, how effective will this lockdown be, and why is it so important for our nation to abide by these drastic measures?
There is a 21-day lockdown that has been instituted by government. How effective it will be will essentially depend on how seriously we as South Africans take this measure. Remember, it's not a suggestion, it's actually the law. It's an emergency protocol where all South Africans must stay at home except for essential purposes. The purpose of the lockdown is that it's necessary to disrupt the chain of transmission of COVID-19, and if we don't flatten the curve of the spread of this pandemic, we risk overstretching our healthcare system, which could have devastating consequences for us in the long run.
What are the most effective ways and actions to take to protect yourself and others from contracting and spreading COVID-19?
I won't go into too much detail here because there is a lot of info online, and we'll speak about resources later. But obviously, washing your hands or using a hand sanitizer if you don't have access to wash your hands is the number one important thing to prevent spread. Also, disinfect frequently touched surfaces. This includes in your home while you're on lockdown. Wear a mask if you are sick to prevent making other people sick, and if you are looking after someone who is sick. And when you do leave home during this lockdown, for example, when you have to go and buy groceries, maintain social distancing, which means trying to keep a distance of at least 1 to 2 meters between yourself and other people.
What kind of medical treatments are required for severe cases as well as cases that may not be so aggressive?
I think first it's important to know the symptoms of COVID-19, and according to the World Health Organization, the most common symptoms are the following. The first most common symptom is fever, so high temperature, followed by dry cough, fatigue, which means feeling tired, producing sputum, which means essentially coughing up slime, and having a shortness of breath. There are others, and you can look at the resources for more detail. But it's also important to remember that if you do start experiencing symptoms, don't panic. A lot of these symptoms could also be flu or cold related. To date, most people, roughly around 8%, who have become ill with confirmed COVID-19 have only displayed mild to moderate signs and symptoms and have gone on to make a full recovery in around 2 weeks. If you do start showing symptoms, I recommend that you first call your doctor's office so they can assess your situation, and they can advise you either if you need to come in for a consultation or if you need to report to the pathology lab for testing. And in some cases, even doctors are offering online consultations as well, so you don't even have to leave your home.
With a lot of information circulating out there online, it's very hard for a lot of people to separate what is fake and what is actually facts, and it can be very overwhelming for a lot of our viewers out there. So where can a person go to find reliable information on COVID-19?
Yeah, there is sadly quite a lot of fake news circulating about COVID-19 at the moment, and I can't possibly list all of the myths here in such a short interview, but two common ones I've heard of that are definitely not effective against COVID-19 are that smoking would help or taking antibiotics. These things can actually harm your progress, so that's not recommended. It's also important to be responsible and only share information from reliable sources. If you aren't 100% sure of a source, rather don't share the information. There's many sources out there, but two that I can just suggest for you that you can look at easily is the South African National Department of Health has set up a support service on WhatsApp. It provides up-to-date information on COVID-19, and all you need to do is WhatsApp message the word HR to 060-012-3456. And a second option is that Discovery Health has created a very nice COVID-19 online portal. Covers a variety of topics, and anyone can access it at their website, which is www.discovery.co.za.
Amazing. Thank you so much for sitting with us and educating us a little bit more on this pandemic and just where we can find more reliable sources.
It's a great pleasure.
Thank you.
Good luck, everyone.